authorizing the Council Committee on Public Health and Human Services to hold a hearing regarding the impact of the Commonwealth failure to expand Medicaid under the Patient Protection and Affordable Care Act.
Thank you very much. Let me just say that I recognize Councilman William Greenlee, and to my right, Councilwoman Maria Sanchez, and other members will come throughout the morning as we have moved on with this discussion. I want to welcome you all to City Hall, and thank you for taking time to come down to express your concerns about the whole issue of the Medicare expansion and the Affordable Care Act. And I do believe we'll come out with some very productive recommendations that we can share with our legislators and the governor, really, the governor. I just want to make a statement before we begin. The expansion, this is a quote, the expansion will recapture $13 billion in federal tax dollars over the next 7 years, money that would otherwise go to other states. The expansion will create a greater safety net for the poor and the mentally ill, and ensure a healthier revenue stream to hospitals, which will have their reimbursement cut for uncompensated care under the Affordable Care Act. Quote, the Affordable Care Act makes sense for the physical and financial health of the state, and the expansion will create more access to primary care providers, reduce the burden on hospitals and small businesses, and save precious tax dollars. End of quote. In reading these two statements, one would assume that these quotes came from Democratic governors. However, this assumption would be wrong. These quotes came from Republican governors John Kasich of Ohio and Richard Biden of Michigan. These governors, as well as the Republican governors of Arizona, Nevada, New Mexico, and North Dakota, have decided to expand Medicaid in their states so that millions of their uninsured constituents can receive health insurance under the Affordable Care Act. And nationwide, a total of 21 states have moved forward with the implementation of this act. In Pennsylvania, Republican State Senator Lloyd Smucker of Lancaster County, Senate Banking and Insurance Chairman Donna White of Indiana County, and Majority Policy Committee Chairman Edward Erickson of Delaware County have called on Governor Corbett to expand Medicare under the Affordable Care Act, Medicaid under the Affordable Care Act. In concert with these senators, State Representative Jean DiGirolamo of Bucks County, who's here with us this morning to testify, Chairman of the House Human Services Committee, as I said, is here with us today to also make that call for the governor to expand Medicaid. Representative, thank you for your testimony and for taking time to join us today in City Council, especially at a late night last night in Harrisburg, debating the electrical. In contrast to these leaders in the General Assembly and his fellow members of the Republican Governors Association, Governor Corbett, in his February 5th budget address, as well as in a letter to House and Human Services Secretary Kathleen Facility, stated that he does not recommend expanding Medicaid in Pennsylvania under the Affordable Care Act due to its cost and lack of flexibility. However, the Urban Institute, a nonpartisan economic and social policy research organization, has estimated that Medicaid expansion would bring an estimated $30 billion in additional federal dollars to Pennsylvania between 2014 and 2022. Additionally, they also estimate that Pennsylvania spending on Medicaid privilege as once again, our hearing today. Again, I thank you all for coming, and I'd like to now call to the witness table State Representative Dean D. Girolamo, Chairman of the Human Services Committee of the